If the problems are systemic, is there anything individuals and families living in disadvantaged communities can do to take matters into their own hands and improve their personal health and wellness? If so, what steps can they take?
So that is a great question. The problems are systemic, and we have to work at every level. Are there things that individuals can do? Yes, there are things that individuals can do. One, we can be more informed about what determines health, and so we can learn to control the things that are within our control to ensure good health. Things like ensuring we get adequate physical exercise, things like ensuring that we get adequate sleep and we recognize the importance of sleep. Things that we do the best we can to get the optimal nutrition. Oftentimes, persons in disadvantaged communities live in communities where there isn't a supermarket that sells fresh fruits and vegetables, don't have space to have a garden, and so forth. But all that can be done within our power, we should do. But we also need to realize that within a community, as individuals, we can come together as groups, including as our local churches, and we can make a difference. There was a project in North Carolina where more than 50 churches came together with an initiative to improve health, with even things like at potlucks or other gatherings they have with food, trying to emphasize water instead of soda, for example, and trying to find ways in which they would share recipes so that they were training and equipping individuals what they could do in their homes, but also what the church can do. I'll tell you a statistic that was quite disturbing. They looked at a group of Americans. They were 18 to 30 at baseline, and they followed them over time, 25 years later, and they looked at obesity. And what they found was the more frequently individuals attended religious services, the more likely they were to be obese 25 years later. I call it the church potluck effect. We need to have fellowship. We need to have good food. But to what extent are we serving healthy foods? And that's why that program in North Carolina I talked about is a really, it wasn't an Adventist program, but it's a good example of churches coming together to enable the church in its programming, but also to educate individuals to be healthier.